Ukraine has been at high risk of outbreaks of communicable diseases for years, having the lowest vaccination rates in Europe. On September 2015, 2 cases of the vaccine-derived polio virus were confirmed in the Zakarpattia region, causing a risk to all children and newborns across Ukraine. Public health authorities in Ukraine declared a polio outbreak and worked with UNICEF, WHO, and partners to immediately respond on the outbreak following the standard operating procedures. 3 national polio vaccination rounds were planned and implemented. More than 12 million doses of OPV vaccines and 1.5 million doses of IPV vaccines were immediately available, and 3 million children were vaccinated more than one time. Additionally, cold chain at both national and regional levels were upgraded. The response started with the development of a communication strategy and plan, creation of a polio slogan with a distinct look and strong call for action, the establishment of a communication task force to ensure proper planning, implementation, and coordination. 95% of Ukrainians were reached through a carefully selected media mix, concentrating on areas with low coverage, tackling negative rumors, doubts about the quality of the vaccine, and attempts to stop the campaign. Activities included in radio advertising using various techniques, animation, and testimonials aired on national and regional channels. Outdoor billboards and city lights strategically placed in low immunization areas. Innovative approaches were used, including transit advertising in subways and railway stations, in-mall activations and roadshows to reach the unreached. Digital signage in major supermarket chains, extensive use of web and social media, print materials including posters, leaflets for parents, coloring books for kids, and info kits for doctors. Media played a major role. Media events and frequent media interviews were organized in high-profile media on national and regional levels to ensure that all parents' fears and concerns were addressed.
For the first time, I heard about polio from the news on TV. Our doctor told us that we can vaccinate our child, so we came today and vaccinated her.
Training and capacity development of health providers with over 6,000 health workers and educators were trained on effective counseling on polio. The training gives a lot of positive emotions and, of course, knowledge. The most important thing is that the training is teaching us to provide effective counseling. According to independent monitoring of the polio outbreak, vaccination coverage and awareness were growing each round nationally and in low-performing regions. Thanks to the campaign, barriers to vaccination have decreased significantly in comparison with 2014.
Before the outbreak happened in Ukraine, we received an assistance from the international organization, including UNICEF and WHO, which helped us to procure enough doses of OPV and IPV vaccines. So when the outbreak happened, we were basically technically prepared.
UNICEF has again supported the ministry from the very start. We have procured the vaccines that were needed. We have also supported very actively a communication campaign aimed really at informing better parents and families. We have also invested efforts and time and resources in improving the capacity of health workers on all issues related to immunization.
WHO feels very strongly that progressive increase in coverage is a reflection of parents' increasing confidence in the vaccine and understanding the importance of protecting their children from disease.
To maintain a polio-free status, strengthening routine immunizations should continue, with the aim of reaching every child and sustaining the gains. Each and every child has the right to be protected against polio. Thanks to each and every one for being a part of these efforts.